Hello there. You are watching CNN Money Switzerland. I'm Ana Maria Montero, and welcome to The One Thing. Switzerland's Federal Council has declared a state of emergency until the 19th of April as it attempts to further stop the spread of the coronavirus, which has now infected more than 2,200 people across the country. This means a partial lockdown for Switzerland, with all but the most essential shops, like supermarkets, banks, and pharmacies, allowed to stay open over the next month. The Army will also step in to support cantons, deploying some 8,000 staff in total to help at hospitals and in providing logistics support and security, for example, at the border. From midnight tonight, the borders with Austria, Germany, and France will be checked and entry bans introduced, except for citizens, those with a permit or who have to come to Switzerland for work reasons. And the Swiss abroad were also urged to come back. Solidarity was the key word from Simonetta Sommaruga, president of the Federation, as she urged citizens to take precautions and follow the advice of the Federal Council. The 10 billion Swiss francs set aside for businesses announced on Friday have also been made available, with 8 billion going towards unemployment benefits. In other news, regulators approved a new coronavirus test that reduces the testing time from days to mere hours. Developed by Roche, it is expected to speed up the ability to test patients by tenfold. In an exclusive interview with CNN Money Switzerland, Roche CEO Severin Schwan talks about the rollout of the test, and actually, it's happening just right now. Severin, thank you so much for joining us. I'd like to kick it off with your reaction to the Federal Council's announcement of a partial lockdown and other recommendations. I mean, what does this mean for a company like Roche?
Well, first of all, there is no doubt that if there are any possibilities to stop the spreading of the virus, this helps. This helps everybody, including Roche, to do what we have to do. Therefore, I welcome the decisions by the Federal Council. I think this will help to contain the situation and to flatten the curve so that healthcare systems are not overwhelmed.
And what about the situation with a lot of the employees that are coming from France, from Germany to work for Roche in Basel? How would that affect?
We have asked our employees to work from home, except those who are working for really critical activities, such as ensuring the supply chain of our medicines and our diagnostic tests.
All right, speaking of medicines and diagnostic tests, tell us about this new COVID-19 that's supposed to be 10 times faster than previous tests. When are we going to get this in Switzerland?
We've already provided the tests over the weekend, so the labs are up and running. What actually helps a lot in Switzerland is that the machines as such, they are already installed, they are already out there in the labs. So it was a matter of developing this test on the highly automated platform. We did this in record time. We got the approval last week. We started shipping over the weekend, and those tests are now available in Switzerland.
Oh, okay. All right. So it's not just the FDA that approved it. It's not just for patients in the U.S. It's also being used here in Switzerland. That's what you're saying?
That is correct, yes.
Okay. All right. And as infections skyrocket, which they are, can you keep up with the demand? I mean, given the ever-expanding lockdown situation worldwide, including now Switzerland?
The supply is not sufficient to meet the demand, so it is absolutely critical to prioritize testing. That means that only people are tested who show signs and symptoms of the disease, so that we can simply deal with the capacity constraints we have, not only here in Switzerland, but worldwide.
And what about Actemra? This is the Roche drug approved for treatment of COVID-19 patients in China. Do you have plans to roll that out in other countries?
What is important to understand here, this is not a medicine which attacks directly the virus, but rather the secondary effects which are caused by the viral infection. So what happens with certain severely ill patients is that the immune system overreacts, and this overreaction then gets really critical for patients. And our medicine, Actemra, helps to soften this immune reaction. It is part of the guidelines in China, and we are in discussions with regulators worldwide to make this medicine available for those patients who get severely ill and have this overreaction of the immune system.
And are you working on any other treatment drugs or vaccines for COVID-19?
No, we are not active in vaccines. We have medicines who help for lung diseases. And like for Actemra, this is not to directly deal with the virus, but to deal with the complications which are caused by the viral infection. And of course, we are in discussions with providers and regulators to make those medicines available.
And while we've seen the market really plunging in the last few days, the share price at Roche, shall we say, has really been able to keep up certain momentum. What is driving this?
I think in general, our industry is less affected by economic cycles. And as far as Roche is concerned, we have a highly specialized portfolio of often life-saving medicines. And again, patients need to continue with their treatments, and I think that's the reason why we are less affected than other industries.
And dare I say that the pharma industry, this is also a business opportunity from this perspective, right?
Not really. If you look at the diagnostic testing, for example, which has been very much our focus over the last couple of months and weeks, we can give relief to the system, but on a group level, this is not really material from a commercial point of view. You also have to see if the healthcare system has to deal with the coronavirus, you have less activity in other areas. So this is really not good news for all of us individually, for patients, but also for the industry.
Wonderful. Thank you so much for your insights, Severin. It was a pleasure having you. And remember, you can get involved in today's news by checking our social media pages, Twitter, Facebook, and LinkedIn. And yes, remember, it's always great to hear from you. Don't forget, everything is also available on our website, CNNNMONEY.CH. We'll see you for a next update. But before you go, we leave you with some images of solidarity that broke out late Sunday for Swiss doctors and nurses on the front line of the fight against the coronavirus. Rome was a scene of similar gestures of gratitude over the weekend. Enjoy. We'll see you next time.